What was your thought process? Have you been mulling this over for a while?
I have. I've been thinking about ways that I can contribute to public service. Frankly, I think we're in a moment right now when we all need to be thinking about ways that we can contribute to our home state, to public service. And so I've been thinking about that as we've been coming back to Maine, as we've resettled here. And we chose to come back to Maine because it's our home. And I think Maine's facing a lot of challenges. So for me, when I think about ways that I can contribute in the public sphere, in public service, running for governor is something I'm considering. Haven't committed to it, but I'm considering it very strongly.
A lot of people running for governor right now, but you would certainly be one of the names that people would recognize, I guess. I guess, what are some of the reasons, I guess, you'd like to be the governor of the state?
Well, what draws me to it is partly what you started with, which is the reception that my family and I had when we moved here initially, and then going through a difficult time together. To see what that opportunity was, again, to see public service in action from that vantage point was incredibly gratifying. And so now for me, the question is, what else can I do to contribute? And Maine's facing a lot of challenges, and they're challenges that I'd like to focus on, whether it's healthcare, housing, childcare, you name it. We've got a litany of challenges in front of us, and so that's why I'm giving this serious consideration. I was honored to be approached by folks to consider it, and so that's where I am right now.
You feel like you would be, I don't know, more of a bipartisan governor at all, or is that?
I think everyone hopes that they would be a bipartisan governor, and I would be no different in that regard. I certainly don't want to get ahead of myself and think about what that would look like. What I can say is that the experiences that I had at the state level, at the federal level, and the work that I've focused on necessarily involves finding common ground. Public health has been quite politicized, but it's also an area of tremendous opportunity. There are aspects of public health and healthcare that are uniquely bipartisan. Clean air, clean water. No one disagrees with those things. My view is that as a policy matter, we should start with the areas where no one disagrees with.
One last quick question. You know, a lot of people don't like the way President Trump and RFK Jr. have treated the CDCs.
Mm-hmm.
Yeah, well, the U.S. CDC. You know, your thoughts about what's going on with public health. I mean, we've got the person in charge of public health right now doesn't believe in vaccines.
Well, public health is facing challenges, if not peril, outright. I'm really deeply saddened by the attack that happened at the U.S. CDC a week ago. I've said for a long time, rhetorically, public health has been under attack. Now it's actually physically under attack. That should concern all of us, worry everybody. It should worry every public servant. But more broadly, and applied to the state of Maine, we also need to stand up for public health in Maine. Public health can't go away. We can't go back to a world where restaurants are unsafe and the water that comes out of your tap isn't drinkable. So we also need to stand up for Maine. And those are issues that I've focused on as long as I've been in government service, 11 years now, and they're issues that I want to keep focusing on.